Hey everyone, this side Rohit Pandey, CPC certified medical coder. So those who are visiting my channel for the first time, kindly share, subscribe my channel. As you know that here we can talk about medical things, medical diagnosis, procedure, and equipment as well. We are talking about only medical. Hey everyone, this side Rohit Pandey, CPC certified medical coder. Okay, sorry for that. Sorry for that. Okay, so today we are going to learn anatomical. We are going to solve anatomical question. Actually, there are 25 questions. So it is first part one where we will going to do 25 questions of anatomy. Okay, so let me share screen. Okay, okay. So so here you can see there are questions. Okay, so we are going to start this. And one more thing, kindly play this video in multiply 2. Okay. Yes. Let me check something. Okay, so fine. So I mentioned that you can watch this video, okay, at multiply 2. Okay, let's start. So our first question is total number of chromosomes in human body: 22 pairs, 23 pairs, 26 pair, 46 pair, and 44 pairs. Firstly, you have to think about the answer and just pause that video. Okay, and then if you answered, then just check what is the are you right or not. Just take it as a test. Okay, so total number of chromosomes in the human body, a 22, 23 to 46 and 44. So answer is b, 23 pairs. Okay, so 23 pairs of chromosomes are in human body. Okay, a patient is diagnosed with a cataract has abnormality, high intraocular pressure, bleeding vessels on the retina, lens that is no longer clear, or corneal neurovascularization. So answer is a lens that is no longer clear. In cataract, we usually saw what happened. Let me tell you what cataract is. Okay. So cataract is a cloudy area in the lens of your eye. Okay, the clear part of the eye that helps to focus light. Okay, cataracts are very common as you get older. In fact, more than half of all the American age 80 or older either have cataracts or have had surgery to get rid of cataract. Okay, so third one, an endotracheal tube is placed inside the trachea or to first drainage peritoneal fluid, drain urine, open airway to breathe, feed the patient. Answer is C, open airway to breathe. An endotracheal tube is placed inside the trachea to open airway to breathe. Okay. So endotracheal tube, we usually we just cut out trachea and open that for air breathe. Okay. What is being done when surgery performs a bilateral oophorectomy? So here, A, sling procedure for vaginal prolapse, B, removal of both ovaries, C, removal of both fallopian tubes, laparoscopic removal of uterus. So yesterday when I was sorry, today when I was teaching you about reproductive system, then in word root we use ophro. Ophro means like ovary. Okay, ectomy is removal of both, you know, bilateral. Okay, so bilateral ophrectomy, so removal of both ovaries, that is called ophrectomy. Ectomy is removal. Okay, removal of something, cut and removed. Fifth one is the digestive system include which of the following? Digestive system include which of the following? A. Esophagus, ileum, stomach, salivary gland, pancreas, liver, C. Mouth, kidney, gallbladder, bladder, colon, and peritoneum. D. Tell me the answer. So answer is salivary gland, pancreas, and liver is the part of digestive system. Okay. Which of the following are considered as to be appendicular skeleton? I already taught this thing in the musculoskeleton chapter. As axial skeleton, there are two type of skeleton. One is axial one, and another was another one is appendicular skeleton. So you have to give answer of this question because I already taught you. Okay. So A, shoulder girdle, pelvic girdle, extremities. B, ribs, sternum, vertebrae. C, skull, rib, sacrum. D, sternum, vertebrae, sacrum. So answer is shoulder girdle, pelvic girdle, and extremities. Extremities and limbs usually we use for hand and legs. Okay, so for upper extremities means leg. For upper limb, for upper extremity or upper limb is known as for it is considered as hand. Okay, we consider as hand, and for lower extremities and lower limb we usually consider it as legs. Okay, so answer is shoulder girdle, pelvic girdle, extremities for appendicular skeleton. Okay, the function of spleen is to maintain an appropriate volume of circulating blood, filter and destroy red blood cells that are no longer efficient, collect lymph from the rest of the body, enable cell to fight against pathogens in the immune system. So tell me the answer. Okay, so answer is filter and destroy red blood cells that are no longer efficient. Okay, so I already told you about the spleen. Okay, once again I'm going to tell you about spleen, a small organ near the stomach that control the quality of the blood. Okay, and here answer is filter and destroy red blood cells that are no longer efficient. Okay, so eighth question is the left ventricle pumps blood throughout the entire body. The left ventricle pumps, we are talking about heart. Okay, the left ventricle pumps blood throughout the entire body because left ventricle is A, weaker and smaller than the right ventricle, stronger and smaller than the right ventricle, weaker and larger than that right ventricle, stronger and larger than the right ventricle. Yes, answer is stronger and larger than the right ventricle. Okay, let me tell you something about. Yes, the left ventricle connects nearly all organ system through its function to pump oxygenated blood to the body. Okay, left ventricle failure would likely result in impairment to all other organ system. Organs may react to low ventricle function by initiating mechanism to increase blood delivery. Okay. So in Google, they anyone ask, is the left ventricle most important? So what they answered, the left ventricle is the heart main pumping chamber. It's pump oxygen rich blood up into the body's main artery called the aorta. The blood then goes to the rest of the body. Okay, so left ventricle is important because it mainly is the heart main pumping chamber. Okay, now our next question. So I already told you answer is D, stronger and larger than the right ventricle. Now spirometry is breathing test, sleep test, sleep study, heart rate monitoring, and study of muscles. So spirometry is spirometry is breathing test. Okay, spirometry is breathing test. So I need to tell you more about spirometry. Let me check on Google Baba. Okay. Spirometry is the most common type of pulmonary function or breathing test. Okay, this test measures how much air you can breathe in and out of your lungs, as well as how easily and fast you can blow the air out of your lungs. Your doctor may order spirometry if you have wheezing, shortness of breath, or cough. Okay. Now, 10th question is, what is the full form of COPD? So, A, congestive obstructive pulmonary disorder, chronic obstructive pulmonary disorder, chronic obstructive progressive disease, congestive obstructive progressive disorder. So, COPD is for okay. So, answer is B, chronic obstructive pulmonary disease. Okay, so let me tell you more about COPD. COPD is like chronic obstructive pulmonary disease, is a common lung disease causing restricted airflow and breathing problems. It is sometimes called emphysema or chronic bronchitis. In people with COPD, the lung can get damaged or clogged with phlegm. Phlegm. Okay, yes. Okay. Now, 11th question is, the process of storing whole tissues or cells at extremely low temperature is known as cryotherapy, cryodome, cryalgias, cryopreservation. Okay, the process of storing whole tissues or cell at extremely low temperature is known as cryopreservation. Okay, so answer is D. Okay, so let me check. Okay, so let me tell you cryopreservation. So cryopreservation is a process that preserves organelles, cells, tissues, or any other biological or constructs by cooling the sample to very low temperature. The responses of living cells to ice formation are of theoretical interest and practical relevance. Okay, now you can better understand. Okay, so here we come with 12th question. Intrathecal injection is administered into the First, dermis and epidermis, ectoderm, subcostal region, spinal cord. Intrathecal injection is administered into the dermis and epidermis, ectoderm, subcostal region, and spinal canal. So answer is D, spinal canal. So I'm going to tell you more about intrathecal injection site. So describes the fluid-filled space between the thin layer of the tissue that cover the brain and spinal cord. Drugs can be injected into fluid, or a sample of the fluid can be removed for testing. So now you can understand what is intrathecal injection. So describe the fluid, actually fluid-filled space between the thin layer of the tissue that covers the brain and spinal cord. Okay, so usually they just put that injection to that layer, and drug can be injected into the fluid, or even during the lumbar puncture we can just take out some fluid for the test purpose. Okay, now come to the 13th. The wound was proximal to the her right knee. Okay, where is her injury? Proximal. Okay, between her right medial compartment and lateral compartment, between her right knee and right ankle. Just make an image in front of your in front of your brain, I mean in your brain. Okay, between her right knee and right thigh, at the same location on her left knee. Tell me the answer. So answer is between her right knee and right thigh. Okay, so the wound was proximal to her right knee. So I will tell you proximal and proximal. Whew. So yes, okay, so proximal is like towards the trunk. Okay, towards the trunk near the origin, so that is called proximal. And distal is away from the trunk. Okay, so away from the trunk is called distal, and towards the trunk is known as proximal. Okay, so growth hormones, it is very much simple. You have to give answer. Growth hormone is secreted by thyroid gland, pituitary gland, parathyroid gland, adrenal gland. You should give answer of these this question, because it is so much easy, and usually we read this kind of question in our 8th or 5th, 6th class, you know. So you should know the answer. Growth hormones is secreted by pituitary gland. Okay, pituitary gland is known as growth hormones. You know, those who have I mean height like giants, they have some issue with their pituitary gland, and it secretes so much, and it, you know, so much hormone, so they got, I mean, say they just have good heights. And similarly happen with the, I think, the great Khali. Okay, so let you know something about pituitary gland. Okay, so I'm using Google Baba, and he's taking so much time. Pituitary gland. Yes, your pituitary gland, also known as hypophysis, is a small pea-sized gland located at the base of your brain below your hypothalamus. It sits in its own little chamber under your brain, known as the sella turcica. Turica. Okay, it's a part of your endocrine system and is in charge of making several essential hormones. Okay. So, I'm telling you more about the pituitary gland. The pituitary gland secretes hormones which carry messages around the body via the bloodstream. Okay, and it controls several hormone glands in the body, including thyroid, adrenals, ovaries, and testes. So is often described as the master gland. Okay, so it is known as master gland. Which organ produce bile? It is also much easier. I mean, it is much easier question. So A, liver, B, pancreas, C, gallbladder, D is villi. Which organ produce bile? Tell me the answer, guys. So answer is liver. Liver produces bile, Guys, if you have any question, then you can ask me. Okay. So next question is the correct definition for the medical term arthrodesis is, yeah, anyone know? A, surgical fixation of a joint, surgical repair of an artery, surgical removal of thrombus, surgical fixation of an organ. The correct definition for the medical term arthrodesis is surgical fixation of joint. Okay, so let me tell you more about arthrodesis. Arthrodesis refers to orthopedic surgery in which two or more bones in a joint are fused to become one larger bone. Okay, arthrodesis, also known as artificial ankylosis or syndesis, in the artificial induction of joint ossification between two bones by surgery. This is done to relieve intractable pain in a joint, which cannot be managed by pain medication, splints, or other normally indicated treatments. Okay, so normal in layman language, you can understand arthrodesis refers to orthopedic surgery, okay, in which two or more bones in a joint are fused to become one larger bone. Okay, why they are doing this? Prevent from pain. Okay, so prevention from pain, they usually surgical fixation of a joint. Okay, fix that joint. Our throat divides into two separate tubes, the trachea and the esophagus. Okay, so our throat divides into two separate tubes, trachea, okay, and esophagus. Okay, so the trachea is like for air purpose and esophagus for food purpose. What prevents food from entering the trachea? So uvula, okay, tongue, trachea, epiglottis. If you saw the movie of Shah Rukh Khan, then he says that from the epiglottis. So that is that epiglottis. Okay. My name is Khan. My name is Khan. In that movie, he usually repeatedly used that word epiglottis, from the epiglottis. Okay. So 17D. So epiglottis is the answer. Our throat divide into two separate tubes, the trachea and the esophagus. So epiglottis prevent food from entering the trachea. Okay. The corpus luteum secretes progesterone What is an effect of this secretion? A. Enlargement and development of organs of the female reproductive system. B. Deposition of fat beneath the skin. Closure of epiphyseal disc and long bones. D. Thicken the endometrium for implantation and is necessary to sustain pregnancy. So 18th is like, what is the answer? D, that is thickens the endometrium for implantation and is necessary to sustain pregnancy. So the corpus luteum secrete progesterone. What is the effect of this secretion? Thickens the endometrium for implantation and is necessary to sustain pregnancy. Okay. 19. Which of the following is malignant disease of bone marrow in which excessive white blood cell produce leukemia, anemia, leukopenia, and leukocytosis? Elevation of blood is known as leukocytosis. Leukopenia, where the white blood cell decrease. Okay. Anemia, when blood in a human body, if hemoglobin is less than 6, I mean it it is different in male and female. So I mean hemoglobin is low then in blood, then it is called anemia. And leukemia is like cancer. So 19th is like A. Leukemia is like malignant disease of the bone marrow in which excessive white blood cell produce. Okay, so I'm going to tell you more about leukemia from the Google Baba. Okay, leukemia is cancer of the body's blood forming tissue, including the bone marrow and the lymphatic system. Many types of leukemia exist. Some form of leukemia are more common in children. Other form of leukemia occurs mostly in adults. Leukemia usually involves the white blood cells. So leukemia is cancer of the body's blood forming tissue, including bone marrow and lymphatic system. Okay, so here you know about leukemia as well. The abdominal area is divided into 4 distinct quadrants. I already mentioned this thing in digestive when I was when I was teaching you medical terminologies, then I told that thing to you. Okay, so 4 distinct quadrants. The liver and the duodenum are found in which quadrant? So right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. So answer is B, right upper quadrant. Okay, the knee joint consists of which 3 compartment? A, medial lateral femoral condyles. B, posterior malleus lateral and femoral facet. Medial lateral and patellofemoral. D is medial trochlear groove and lateral malleus. So answer is C, medial lateral and patellofemoral. Okay, so the knee joint consists of which of the 3 compartments? Medial, lateral, and patellofemoral. Okay, what connects the large and small intestine? Ileum, appendix, cecum, epiglottis. So answer is C, cecum. Okay, a dacrocystectomy describes describes excision of cornea, excision of the sclera, excision of lacrimal sac, and excision of pupil. So if you just watched my video, then you can realize that I already teach you that dacro is using for lacrimal or tear glands. Okay, so excision of lacrimal sac. Myringectomy is a surgical incision, octomy, not ectomy. Okay, surgical incision of the tympanic membrane, surgical removal of the breast. Okay, surgical removal of the eardrum, surgical opening of the mammary gland. So answer is let me check. Surgical incision into the eardrum to relieve pressure or drain fluid. Okay, that is called myringotomy. It is not stomy. Okay, so opening of so you can confuse in you get confused if surgical opening of the mammary gland, because it is otomy, not ostomy. Ostomy is opening. Okay, now we are on the last last question. So we will complete another part on yesterday basis, on yesterday, oh sorry, on tomorrow. Okay, on Sunday. Last question. A patient who is incontinent, is unable to stand erect, is unable to hold urine, is unable to assume prone position, is unable to hold their breath. So answer is unable to hold urine. Okay. Incontinent is a person who is unable to hold urine. Okay. So that is called urine incontinent. Okay. And ICD-10 of urine incontinence is R3981. Okay, where a person unable to hold urine is like urine incontinent, and ICD-10 for this is like code is like R3981. So on tomorrow we will start from 26 and complete till 50. Okay, 50, and then we will go with these things. Okay, so I hope you like that video. If you like it, kindly share this video with those who really want this kind of videos. They are economically weaker, so they are not able to, I mean, prepare for CPC certification. Okay, but the thing is, we have those who are economically stable. We have coaching center, I mean coaching thing for them. We started classes for them. I mean, those who are really interested and serious for the CPC examination, those who first time heard about medical coding, okay, they just visit us. I mean, not physically, they just call us on 8178385424. I will put this number on the description. You can contact me, but please don't call me at night. Okay, and you can WhatsApp. You can just put WhatsApp on that. Okay, our team will definitely connect with you. And second one, it is for CPC certification. Those who are interested for CPC examination, we will prepare those student as well. And we have second offer, where those who really, I mean, fed up with their specialty, they don't want to work in radiology and pathology, and there are lots of specialties. They are just frustrated of that, and they just want to change their specialty to ED and evolution and management, I mean ENM. So they just call us on 8178385424, and I place this number on description. They can contact us. Okay, we will definitely revert you. Okay, our team will definitely revert you. You can ask a fee structure and what we will give you. Okay, what material and whatever thing you just ask from our team. Okay, so now we are on the last stage of this video. So at last, I'm saying that please subscribe this channel and share this videos with those who really interest, who really want that video. Okay, for their preparation and all. So thank you so much. Good night. Bye.